Hi, I'm Dr. Cohen. If you've clicked on this icon, you're interested in body contouring, specifically in the area of tummy tucks. Tummy tucks are a very common procedure done in my practice in the United States. Tummy tuck is also known as an abdominoplasty. What does that mean? Well, many women who've had children particularly, or women and men who've had significant weight loss, such as in post-bariatric or stomach tightening or stapling surgery or lap band procedures, will have a lot of excess skin on their abdomen. And liposuction simply will not be enough to get rid of all the excess skin. And in fact, liposuction alone for people who have excess skin or hanging skin or stretch marks will make that area worse, because you've emptied out a fat bag, if you will, of skin, and that will require you to come in and get that removed later. So if we know that in advance, we're going to suggest a body contouring procedure which is going to involve skin removal. Well, let's talk about a tummy tuck. Tummy tuck will treat people's abdominal walls. For those of you who have excess fat in your love handles, usually liposuction as a combined procedure with a tummy tuck is done. If you have significant excess of fat and skin on your love handles, we'll excise the skin along your love handles as well. Usually there is some liposuction done at the love handles, and it's important to know, however, that the back cannot and should not be liposuction at the time of the tummy tuck, because the blood supply to the abdominal wall comes from the back. So people ask me regularly whether I can suction above their love handles in the back, and the answer is no. But a tummy tuck will do a lot of things. Number one, it will typically remove all the excess skin below your belly button down to the level of the pubis. Number two is, many people who've had massive weight loss or pregnancy and then weight loss will have separation of the washboard muscles of your belly, called your rectus muscles. Those washboard muscles will often separate and allow you to, or cause you to have laxity of your abdominal wall. So in a tummy tuck, we're going to be lifting all the skin and fat up to your rib cage off of your muscles. We'll be tightening the muscles up, usually with a permanent suture. Your belly button will be cut and sized around and left in place, and then poked out through a new incision. So at the end of the liposuction and lifting of the abdominal wall flap and removal of skin, we're going to put you into the sitting position while you're asleep. And this procedure is virtually always done under general anesthesia. The belly button then gets poked out through a new incision. So if you browse through my web gallery, you would see that the scars from a tummy tuck are usually hidden in the bikini line, and along with one around the belly button, where your belly button gets poked out through a new incision. People ask me all the time, well, what about a mini tummy tuck? Well, a mini tummy tuck is really selectively used for those patients who have very little lower abdominal excess skin, who are typically extremely thin, who have no excess skin above their belly button, and I think less than about 5% of the patients that I see. If you need a full tummy tuck, get it, because otherwise you'll be rather disappointed with the results and you'll wind up coming back for more surgery. The recovery from a tummy tuck is not a day at the beach, and it's not a day at the day spa. Most of the things that I do cosmetically, it does give people the most pause in their day-to-day life. Most people take off 10 to 14 days from work. You will have a drain in place when you go home, which is going to collect the fluid that accumulates under the abdominal flap. That drain can come out anywhere from 3 to 14 days after the surgery, depending upon how much fluid is coming out of those drains. Virtually always the procedure is done as an outpatient, which I think is better in this era of better narcotics and increased risk of hospital-acquired infections. And frankly, you get better care at home. So the patients are simply asked to sleep with their backs elevated and something underneath their legs to prevent them from going into a completely flat position. And most people can't walk upright for 2 to 3 days after a tummy tuck, as the swelling's going down and things are being stretched out. One of the other interesting features of the tummy tuck is that your whole abdominal wall skin will be numb for about a year. Most of it comes back, but it's something you need to know. What are the risks and complications of the tummy tuck? I think it's important that people hear it. It's interesting that the rate of blood clots that can occur in your legs are greater with a tummy tuck than virtually any other procedure that we do, for reasons unknown. For that reason, we take great precautions to prevent blood clots from forming. When you go to the operating room, we always put compression stockings on your legs, and once you're asleep, we give you a mild blood thinner called heparin, which helps prevent the blood clots. But one of the most important elements in prevention is you getting up and moving around after the surgery, not lying around in bed. Another advantage to being home. We want to get you up and get you moving right after surgery. That does not mean exercising, but it means getting up, walking through bed to the bathroom, to the couch, to the kitchen, and taking it easy and gradually increasing your activities of daily living over the course of 2 weeks. So, risk of blood clots, pulmonary emboli, numbness to your abdominal wall, and minor wound healing problems are hallmarks of the complications associated with tummy tucks. All that said, I do anywhere from 2 to 5 tummy tucks a week. Very common procedure done both in my office and nationally with um, very high satisfaction rate. What's also very interesting about a tummy tuck, because you're doing muscle tightening, most patients aren't very hungry after surgery, and my average patients can lose anywhere from 2 to 6 dress sizes over the course of 3 months because they simply can't eat. It's like you have an internal corset that's put inside your abdominal wall and you just can't take in much food. So the real benefits of the tummy tuck transcend and go beyond just what I'm taking out in the form of skin and fat, and really are a terrific procedure for the postpartum mom who's looking to be restored and put back. I strongly urge people wait till they think they're done having children. That doesn't mean you can't get pregnant. In fact, I've had several people decide to get pregnant after a tummy tuck and successfully have children, but there's no reason to get it done if you think you're going to go through pregnancy again. It's also important to maintain your weight after surgery and to use this as a jump start into an exercise and new diet regime. It's a great operation. We do it here in-house. Again, it's outpatient. I strongly urge you to visit my photo gallery. If you have any further questions, don't hesitate to contact me for my free books or come to the website and look through the photo gallery.